Crosby to move the motion, and I'm then going to call the Minister to respond. There won't be an opportunity for the member in charge to wind up, as is the convention, for 30-minute debates, or indeed for anyone else to speak, but there will be potentially opportunities to intervene. Virginia Crosby to move the motion.
Thank you, Chair. It's an absolute honour to have you chairing this important debate. I'd like to thank you for the opportunity to hold this important debate on cross-border cooperation on the health service. As the Member of Parliament for Ynysmore, my constituents, like those of my colleagues here today, are served by the devolved Welsh NHS, which is managed and funded by the Welsh Government in Cardiff. Now, despite health being devolved for 25 years, around a third of my most serious casework is for my constituents who are suffering, perhaps even dying, because of failures in our local health board. I hear from patients, families, and even members of staff who are deeply, deeply concerned about Betsy Cadwaladr University Health Board, or BCUHB for short, and the effect its failings are having on the people of North Wales. That is why my colleagues and I want the UK government to help find a solution, and why we desperately need three things. One, much better cooperation across the borders on our health services. Two, data that allows the direct comparison of performance across all health boards in the UK, regardless of whether or not they're devolved. And three, a recognition that the UK government has a moral and arguably a legal duty to take action where the well-being of its citizens is compromised, and the willingness to act on that duty where necessary. I can best explain why we're so concerned by sharing with you the issues we face in North Wales. BCUHB is by far the largest health board in Wales. With a budget of £1.9 billion, it's responsible for a quarter of the Welsh population, more than 700,000 people spread across a huge area, roughly 4 times the size of Greater London. BCUHB is currently in Welsh Government special measures, not for the first time, for the second time, with 6 of the last 6 years spent in special measures. Despite this, its performance seems to be getting worse, not better. It's being called dysfunctional, it's being called chaotic, it's being called a basket case. In February 2023, the Welsh Health Minister sacked its entire board. An audit of its 21 to 22 accounts found £122 million unaccounted for, with senior executives accused of deliberately falsifying entries. It is now on its 8th chief consecutive in 11 years. And this is despite a devolution settlement which funds the Welsh Government with £1.20 per person for every £1 we spend here in England. It's difficult to relate just how bad some of the stories I hear are. People discharged from hospital sicker than when they went in, hours waiting for ambulances and hours in ambulances waiting outside A&E. Errors in patient records, appointments being lost, significant failures in the provision of medication, palliative patients dying in hospital because fast-tracking them home will take weeks, and medical appointments being cancelled and rearranged for hospitals 60 miles away.
Will my honourable friend give way?
Of course.
I thank my honourable friend for giving way and congratulate her on securing this important debate. Now, Betsy Cadwaladr University Health Board has over the last decade received the 11th greatest number of prevention of future death reports of any organisation in England and Wales. To put that into perspective, organisations with comparable numbers of such reports are generally whole United Kingdom government departments. So does my honourable friend agree that this is a damning indictment of the poor state of health services in North Wales, and further emphasises serious concerns over the adequacy of those devolved services?
May I thank my honourable member, the MP for the Vale of Clwyd, for his intervention. But it gives me an opportunity to thank him for his hard work, fighting for his constituents, not only his constituents, but all of those across Wales. They deserve a better service than that they're actually getting. And it's only by working together we can actually get some action. So I'm absolutely delighted that he's here today. He's a doughty campaigner and a doughty champion for his constituency. Of course.
Can I just say this? That we've in the past have had a scheme in Northern Ireland. It was the Northern Ireland Republic of Ireland Cross-Border Initiative. It was officially closed in December 2020 due to the withdrawal of EU funding. It was a scheme that many of my constituents bought into, did well, and got their operations in down south, and then come back to Northern Ireland. The scheme allowed for residents of Northern Ireland to get treatment down south to skip long waiting lists. So does the Honourable Lady, she's absolutely right to ask for better cross-border health cooperation from Wales and England, and I understand the reason that. But I believe there's an argument to be made to M. Caroline and to the Minister for a scheme that goes across all of the United Kingdom of Great Britain and Northern Ireland, because I think there is cross-border issues that we can all take advantage of. So while the Honourable Lady is asking specifically for Wales and England, the title of the debate, if you don't mind me saying, is Cross-Border Health Services. Therefore, it's something that perhaps we could all ask for.
May I thank the Honourable Member for Strangford for his intervention, but also particularly for highlighting that feedback as to how it actually works in terms of these cross-border cooperations. And of course, I'm focusing on Wales, but I think my colleague quite rightly highlights how it's the United Kingdom. It's the United Kingdom, and it's working together how we can actually solve these issues and really give a collaborative approach to healthcare for people across the UK. I also wanted to add to my list of failures the near collapse of local NHS dental services. I could honestly stand here and reel off story after story of lives drastically and sometimes irreversibly impacted by the failures of BCUHB. In Holyhead, the largest town in my constituency, 2 GP practices were merged during the pandemic into Hub Iechyd Cubby Health Hub. This practice has suffered a series of problems, including twice reaching the threat of having no GPs. This is in Holyhead, the largest town in my constituency. One of the main things that would make a difference to Hub Iechyd Cubby and the people it serves would be to co-locate the 2 original practices. Plans have been proposed for this, and in the longer term, a state-of-the-art healthcare centre for Holyhead. The co-location project would deliver economies of scale that would vastly improve the service they can deliver and therefore patient outcomes. This project was allegedly given the go-ahead 2 years ago, Minister, but has stalled and stalled in BCUHB's hands and has now completely stagnated. Likewise, the Integrated Health Centre has been under discussion for years and remains under discussion, with no foreseeable progress likely. Lack of funding is the generally cited problem. Hub Iechyd Cubby serves 9,000 patients, Minister. There are around 15,000 people in its catchment area. This is not a minor backwater in North Wales. It's a large town, and yet it has no integrated healthcare, an A&E that is 25 miles away, across a bridge that closes in high winds, and a massive shortage of doctors. I've launched my own petition to raise the issue and call on BCUHB to proceed with the co-location project and start work on the health centre with urgency. I recognise that the NHS across the UK faces significant pressures, but people are actually moving out of my constituency to live in other parts of Britain because they're scared of becoming ill in North Wales. There are too many stories of avoidable death and harm. Unfortunately, it's almost impossible to compare the situation across the devolved nations and see just how bad it really is, because the Welsh Government produces different data to the UK Government. This makes it almost impossible to compare patient outcomes cross-border. What we do know are facts like, in 2023, over 22,000 paramedic hours were lost in Wales just waiting outside A&E. In January 2024, more than 3,000 people in North Wales waited for more than 12 hours to be discharged from A&E. And nearly 60,000 BCUHB patients had been waiting more than 36 weeks to start treatment in January 24. 6 years before, that number was just under 10,000. And over 57,000 people across Wales have been waiting more than a year to start treatment, with 24,000 patient pathways waiting more than 2 years. We know that since 2010 to 11, the Welsh Government has increased health spending by 30.6%, well short of the UK Government's increase in England of 38.9%. And we've asked the UK Government for help on behalf of our constituents. Last year, the then Secretary of State for Health and Social Care wrote to the Welsh Government to offer a right of access to NHS services in England for people in Wales. Unfortunately, the Welsh Health Minister claims not to have the additional budget to facilitate. This proposal, despite the clear benefits it could offer our constituents. The Welsh Government can, however, find an estimated £100 million to increase the number of Senedd members from 60 to 96, £4.25 million to buy a farm which it now cannot develop, and over £30 million to implement the much-derided default 20-mile-an-hour speed limit. The Welsh Government approach is also highly inconsistent. Take, for example, the COVID pandemic, where the Welsh Government seems to be unaware that it would have to provide its own response to the threat, despite having been in charge of healthcare in Wales for years. They then prevaricated and created different measures and responses, but want to be part of the UK COVID inquiry rather than holding their own inquiry. They seem to think they can pick and choose as to when they are accountable. It would be fantastic to see the Welsh Government prioritising health like the UK Government is doing. For example, with its move for pharmacies in England to be able to prescribe medication for common conditions like earache and impetigo. It's challenging being a UK MP in Wales when a matter like health is devolved. Many people don't realise this and blame Westminster for failings.
My goodness me, it rings a bell with me. Just a quick one. I have a GP friend in Caithness who developed a cataract. It was an aggressive cataract, and within a matter of a very short space of time, she would be unable to drive, and had to give up her practice. So she put her name down on NHS Scotland. Shortly afterwards, she went private and got it dealt with. 14 months later, she got a message from the NHS to say she could have a consultation, not treatment, but a consultation. She would have grabbed it with both hands if she could have got treatment across the border in England. There's a lot wrong with the NHS in Scotland. It's too bad none of the nationalists are here. They should be pressing for cross-border cooperation as well. Let's hope we get it.
May I thank the Honourable Member for Caithness, Sutherland and Easter Ross for sharing some background information of the situation in Scotland with his colleague and waiting for a consultation for 14 months for a cataract consultation. And I think you make a very important point. Here in Westminster Hall, there should be many more members of Parliament here. So we've got the Minister here, so it's an important opportunity to share some of the dreadful, terrible stories that we have. So as I was saying, it's a challenge being a Member of Parliament in Wales when the matter like health is devolved, and it is a third of my post bag. Many people don't realise this and they blame Westminster for failings. And despite it being not our gig, my colleagues and I cannot turn our backs on our constituents. We cannot blame Wales and ignore their problems because these are life and death situations. We desperately need the UK government to step in and up the ante on cross-border cooperation. We desperately need the UK government to take this matter in hand and do something now to protect the well-being of British citizens. Will my right honourable friend commit to visiting Ynysmore and meeting my constituents who have suffered as a result of the BC UHB failures and those who desperately need an integrated medical centre in Holyhead? Diolch yn fawr.
Well, thank you, Dame Caroline. It's a pleasure to see you in the chair. And can I start by congratulating my honourable friend for securing this debate on cross-border healthcare. I know the performance of health services across the United Kingdom is a subject close to her heart, as it is close to the members for the Vale of Clwyd, Strangford and Caithness, Sutherland and Easter Ross, who have all made important contributions during today's debate. I'd also like to highlight my honourable friend's tireless work that she's taken to improve local health services in her own constituency of Ynysmore, including campaigning for an integrated health centre in Holyhead and championing the importance of mental health by pushing for 100 members of the public to undergo a mental health training course in Anglesey. Whilst my honourable friend quite rightly said in her speech that healthcare in Wales has been devolved for 25 years, as a representative of the UK government and as a proud unionist, I feel it's important that all four nations work together where that is of benefit to the people that we represent. For that reason, within my first few weeks in post, I was very pleased to visit Wales, Scotland and Northern Ireland to look at the different approaches being taken to the shared challenges we face. During my visit to Wales, I heard directly from some GPs in my right honourable friend, the member for the Vale of Glamorgan's constituency, as well as meeting some of the pioneering Welsh life sciences companies whose innovations have so much to offer the NHS across the whole United Kingdom. And I would, of course, be delighted to visit my honourable friend's constituency to learn more about the challenges she faces in her own constituency. Without doubt, one of the biggest challenges being faced in all four nations is dealing with the legacy of COVID-19, which has left us with record waiting lists. Cutting waiting lists in England is one of the government's top priorities, and by delivering on the actions set out in the delivery plan for tackling COVID-19's backlog in elective care, we are making good progress on tackling the longest waits. Thanks to the incredible work of NHS staff, as of February this year, the number of patients waiting over 18 months has been reduced by almost 90% in England, a far faster reduction than we've seen in Wales or Scotland. A core part of this approach has been empowering patients to make decisions on their care by choosing their provider. Improved choice can not only lead to shorter waiting times for patients and incentivise providers to offer appointments, but can have a positive impact on the overall patient experience. However, as my right honourable friend, the former Health Secretary, said last year, it is vital that the UK Government and devolved administrations work together to ensure that no matter where you live, patients can access the care that they need when they need it. And as my honourable friend said in her speech, a genuine offer was made to the devolved administrations, and that offer remains open. We continue our commitment to closer working with the devolved administrations on elective recovery and access to primary care. This is on top of the existing cross-border arrangements in place which allow patients who live in Scotland and Wales to access care in England under certain circumstances, which is paid for by the relevant administration. It is important because when adjusted for data differences, the Welsh waiting list of 677,000 represents 21.6 patient pathways per 100 in the population, compared to 13.3 per 100 in England. The magnitude of these differences between England and Wales cannot be accounted for by divergent definitions. That is why my right honourable friend, the Secretary of State, will be engaging with her counterparts as her predecessor did, and I am pleased to confirm that the next Interministerial Group for Health and Social Care meeting will take place on the 24th of April. Further, we have agreed to take forward these meetings quarterly. The Interministerial Group for Health and Social Care includes ministers from the UK Government and the devolved governments who have health and adult social care matters in their portfolios. It provides the forum for strategic discussion between the portfolio ministers on health and adult social care policy issues, enabling ministers to engage on areas of shared interest and, where possible, collaborate on policy development and address shared challenges. Moreover, officials have been working on sharing lessons and comparing approaches to demand management and supporting those patients who have been waiting the longest, including through the Getting It Right First Time programme. These discussions have been constructive in highlighting the benefits of sharing approaches to elective recovery. My honourable friend made some excellent points on how critical data is as a tool for improving health and also tackling inequalities. This government and the devolved administrations have been doing important work to improve data comparability in the UK. Not only is it fundamental that citizens can scrutinise the performance of their health services, but a coherent picture of health across the UK is essential to policy evaluation so that we can provide robust challenge and support where it is needed and build a deeper understanding of the health outcomes in the different parts of the United Kingdom. The Office for National Statistics has recently expanded its cross-government work and partnered with health bodies in all four nations to ensure data is coherent, accessible and meets users' needs. Through this, we will enhance our collaborative working and ensure health services work for every citizen, regardless of geography. Then, Caroline, in conclusion, I'd like to pay tribute to my honourable friend for the work she has done to improve health services in Wales and promote the importance of cross-border health cooperation across the entire United Kingdom. Not just in today's debate, but week in, week out, the member for Ynys-Môn has regularly raised the concerns of her constituencies with both myself and other health ministers. Her constituents could wish for no better representative than her. I hope that what I have said today shows that we are committed to improving health services for everyone across the whole of our United Kingdom.
Thank you. The question is that this House has considered cross-border cooperation on health issues. As many as are of that opinion say aye. Aye. On the contrary, no. I think the ayes have it. The ayes have it. Order, order.